Thank you so much for this informative presentations. My name is Suad, and my question is, with the lack of having clinical psychologists or psychologists in general in our schooling system in Abu Dhabi here, how can the psychologists, the clinical psychologists working in the medical field can work with the school in the implementation of any behavior management plans for the students?
Okay, thank you, Ms. Suad, for your important question also. Actually, based on the clinical approach related to the children and even adolescents, any school has to have an educational psychologist. Educational psychologist, it's not the same branch of clinical psychology. Clinical psychology is different than educational psychologist, but they are working together, and the educational psychologist, he should be in most of schools, especially schools, even schools with normal children, whether the school for normal children or for children with special educational needs, because educational psychologist will identify the observation tools and make observation method for all the children in very accurate way, and identify the behavior, inappropriate behavior, which is need intervention. And based on this, he will make his assessment related to the educational psychometric tools also. We have kind of educational tools to assess the children and the adolescent, let's assume, with learning disability like dyslexia, dysgraphia, and dyscalculia, like using Illinois. So this is the mission of educational psychologists to observe this. Based on many schools, unfortunately, doesn't have, or they, as you reported, Dr. Suad, that she know, or you have lack of psychologists or educational psychologists in the school. So this is a predicament issue, and it's need to modify the school plan about this, or that the teacher himself, because kind of assessment, it can be done for the teacher also, like corners. It's an assessment who doing for and applying for teacher, because teacher can observe the child in the class. So if the teacher himself can transfer that child and his parent to the specific centers, qualified centers with clinical psychologists, then we will have a solution for this dilemma. But if the teacher himself doesn't know about child psychology, or he cannot make a comparison between child who have ADHD, attention deficit hyperactivity disorder, in comparison with another child who has conduct disorder, so it will be a predicament this time. So any school has to have educational psychologist, actually.